You know, we had a tragic reminder just this last week about the need for focus on mental and behavioral health. But this is a problem that has long plagued Colorado and has really devastated too many families. Colorado has one of the highest youth suicide rates in the country, and that is not acceptable for our great state of Colorado. It's even higher in southern and southwestern Colorado, among the highest rates in the country. And yet we know, and the data shows, and the science shows us what we can do to reduce the youth suicide rate. There's too many Colorado kids who don't have access to the mental health services and support they need, especially kids who are subjected to additional stress and financial burdens due to an out-of-home placement situation. What this bill does is to make sure that HCPF is able to provide wraparound services for Medicaid-eligible children in and out of home placement or at risk of out-of-home placement. It also requires the establishment of an integrated pilot for child and youth behavioral services, and really will help us implement a statewide screening tool and a statewide referral and entry point for children and youth with a positive behavioral health screen so that they can actually receive the services that they need to thrive. This bill that we're about to sign is truly a bold step to address a problem that's affected far too many kids and families in our communities. This is also very consistent with our administration's broader effort to create a comprehensive approach to behavioral health in Colorado for people of all ages. We're in the process of signing a number of bills that support mental and behavioral health. The Behavioral Health Task Force that we're setting up will undergo a top-to-bottom review of our system so we can really update and improve efficiency and ensure Coloradans are getting the care that they need when they need it. We need to do better for our children, and I want to thank the lawmakers and the advocates who helped make this a reality today so that we can start doing better for kids in ensuring access to behavioral health services. I would like to introduce one of the lead House sponsors, Representative Meg Froelich.
Thank you, Governor, and thank you, Lieutenant Governor, for your leadership on this issue. We've been asking for way too long for a concerted effort to address youth mental and behavioral health. This bill is that. I'm delighted to have played a part in it. It really comes from the leadership of Senator Rhonda Fields and Senator Bob Gardner. Much appreciation. I'm so grateful for my cape. Thank you, Kate and Lucy. We aren't the heroes. The heroes show up in this building every day and in children's hospitals across Colorado, and they were begging for reform and resources, and we hope that this bill is a big step in that direction. Speaking of leadership, I would like to now introduce our Senate sponsor, one of our Senate sponsors, Senator Bob Gardner.
Thank you. Thank you, Representative Froelich. The tennis shoes are blue, the capes are red. It is a great color combination for a bill like this. I want to say something very important about important legislation like this. Legislators take a great deal of pride in getting it done and having it signed today. Thank you, Governor. But the reality is that bills like this on important issues like this don't happen without great advocates from the community. And among those advocates, the great organizations, Children's Hospital, Mental Health Colorado, Healthier Colorado, the Kemp Center, the Federation of Families for Children's Mental Health, the American Academy of Pediatrics, and many, many more. Without their advocacy and their support, their encouragement to us on a daily basis, Senate Bill 195 wouldn't be a reality today. So thank you very much. It is also a truism at the state legislature that great bills don't happen with great bipartisan sponsorship. I have been privileged over my time both in the House and the Senate to sponsor great legislation with my friend and colleague, Senator Rhonda Fields. I think this may be the first bill with Representative Froelich. Representative Landgraf, my colleague from El Paso County, couldn't be here today, but I've had the privilege of sponsoring many important bills with her, and I want to extend my appreciation to all of them for making this happen. And once again, thank you to Children's Hospital for addressing youth mental health in our state. Thank you.
Good afternoon, everyone. I feel like Wonder Woman. I want to thank my colleague in the Senate, Bob Gardner, for his partnership on this bill, as well as my support in the House. He's already extended thanks and appreciation to those who were advocates and sponsors to help us get this work done. It was not easy. We worked through the summer, through the fall with stakeholders, and we got it done. But the reason I'm here, I'm going to pass my time over to the family and to the kids, because they are the inspiration behind the work that we're doing right now. This is all about you. And you made us understand that there's no time to waste when it comes to